Post-hair transplant care. First day after transplant. Keep the treated area clean and dry. Avoid touching or rubbing the scalp and avoid applying any pressure. Do not use any products or solutions unless specifically advised by your doctor. After washing the donor area at the clinic, you can continue this process at home with baby shampoo. First to third day. Sleep with your head elevated at a 20-30 degree angle, using 2 soft pillows or in a recliner to help prevent swelling. Cold compress. Begin on the first day post-transplant and continue until the 3rd day. Apply the compress to your forehead and around the eyes. Apply every 20 minutes with a 10-minute break in between. Starting day 4. Warm compress. Use a warm, moist towel. Apply the compress to your forehead and around the eyes. Apply every 20 minutes with a 10-minute break in between. Day 2 to day 10. Donor area care. Gently shampoo your hair, carefully patting the donor area. Let water flow over it without direct pressure from the shower head. Gently pat the donor area dry with a towel. Avoid rubbing. You may gently massage the donor area to alleviate discomfort. Ensure the donor area remains dry and clean. Day 8 to day 10 after transplant. Between days 8 and 10, Padra Clinic has scheduled a hair wash appointment for you, which has already been sent to your email. Our team will handle this appointment to ensure proper care of your transplanted area. Alternative at-home instructions. If you're unable to attend the scheduled appointment, you may follow these steps at home. Apply foam from baby shampoo to your transplanted hairs and leave it on for 5 to 10 minutes. Rinse by pouring water over the donor site, allowing it to flow gently over the transplanted hairs. Repeat this process for 30 minutes, 3 times a day for 3 days, 10th to 14th day. Scabs and crusts. Expect scabs and crusts to gradually come off. These may contain hairs, which is normal. Laser therapy guidelines. First set of 10 sessions, perform every other day following a hair wash. Second set of 10 sessions, schedule these sessions 4 months after the initial hair wash, also every other day. Third set of 10 sessions, complete the final set 6 months after the initial hair wash. Alternative schedule. If unable to attend sessions every other day, opt for twice weekly sessions, maintaining the same structure across the 3 intervals of 10 sessions each. Additional products. Biotin spray. Apply twice a day after hair wash. First set of 10 sessions. Perform every other day following a hair wash. Supplements. Take biotin and zinc supplements once daily after meals. Shampoos. Start using Padra baby shampoo after hair wash. Once finished, transition to Padra caffeine shampoo. Foods for optimal recovery after hair transplant. Protein-rich foods, eggs, fish, chicken, lean meats, and Greek yogurt. Anti-inflammatory foods, turmeric, ginger, garlic, blueberries, strawberries, and spinach. Vitamin C rich foods, oranges, kiwis, and bell peppers. Foods to avoid after the transplant. Spicy, greasy, or junk foods, alcohol and caffeine, excessive salt. Post-procedure observations. You may experience swelling around your forehead, eyelids, and cheeks, which is normal. This swelling tends to worsen over the first 3 days, then rapidly resolves. It is soft to the touch and neither red nor hot. Use ice packs on the forehead for 10 minutes, 4 times daily to help reduce swelling. Do not ice the grafted area. Keep your head slightly elevated. Each hair graft will be covered by a small scab that will fall off within 14 days. The short transplanted hairs will shed within the first month and remain dormant for about 12 to 20 weeks. Hair density slowly increases over the year as new hair begins to grow. After about 12 weeks, as transplanted hair starts to grow, you may develop some ingrown hairs in the form of small pimples or whiteheads. Help them subside by applying warm compresses or gently pressing. Itching in the donor area is common as the area heals. Avoid scratching or picking at the area, as this may disrupt healing. Avoid touching the transplanted area until after the first hair wash, as touching may disrupt the grafts and affect the healing process. Never place the compress directly on the transplanted area. Avoid high or direct heat, as it may damage the skin. Use a high pillow to keep your head elevated while sleeping, which helps reduce swelling. Drinking sufficient water and reducing salt intake can also help minimize swelling. If swelling occurs, gently use your fingertips to massage the forehead. Start between the eyebrows, moving upwards above the nose, and then outwards toward the sides of the forehead. Prohibited activities after transplant. Alcohol and aspirin, avoid for at least 2 weeks post-transplant, as they can interfere with healing and increase the risk of excessive bleeding. Smoking, avoid smoking at least 4 weeks after the surgery due to its impact on blood flow and healing. Refrain from strenuous exercise, lifting, or straining for at least 2 weeks post-op. Scheduling of other activities. Coloring hair, wait 3 months. Shaving and hair clippers, wait 2 months. Styling with scissors, wait 1 month. Sexual activity, allowed 3 days after the transplant. Sun exposure, avoid direct sunlight for 2 weeks. Wearing hats, avoid wearing loose hats for 2 weeks and hard or rigid hats for 1 month. Sports, resume professional sports 3-4 weeks post-transplant, depending on recovery. Additional post-care tips. Stay hydrated and maintain a nutritious diet to support healing. Keep all scheduled appointments to monitor your recovery. Avoid strenuous activities for at least 10 days post-transplant. Eating pineapple is beneficial because it contains bromelain, an enzyme known for its anti-inflammatory properties, which can help reduce swelling and promote healing after surgery. If you prefer, taking a bromelain supplement could provide similar benefits. However, discuss this with your doctor to ensure it is safe and appropriate for your specific health needs.